Hi, my name is Michelle Woods, and I'm a registered nurse working with patients who are postoperative, primarily total joint replacement, hip and knees. And most recently, we've had a physician who started using the Prevena Plus incision management system. The Prevena is a negative pressure wound and incision management system, and it's used to reduce postoperative swelling, help improve healing. It can be used primarily on closed incisions, and it can be used whether it is draining or not. There is a collection canister attached to the unit. The dressing that is placed is similar to what most people are used to seeing with the wound vac system, and it has a piece of foam and a clear tegaderm-like over layer, and it sucks down when the unit is turned on, and it doesn't need to be changed for the duration of the therapy. The negative pressure unit is battery operated and portable, and depending on the model, it has either replaceable just AA batteries, or it can be charged with and include charging wire. The components that come with the basic setup are as seen here. This dressing is, I'm not sure if you can tell, but it's for a total knee replacement, and it wraps around, which provides kind of like a compression dressing, which helps with the swelling as well as the negative pressure. It comes with the small unit. It comes with a connecting tube, which also has a connector that if it needed to be hooked up to traditional suction unit, it could be adapted. There's a canister which is removable and changeable if it does happen to drain and fill up. It comes with a carrying case that has a special little strap that's adjustable, and a charger for the rechargeable battery. All the parts are included in a kit, and the patient is given the whole kit with a brochure to take home and a phone number to call if they have any problems. Some of the benefits of the Prevena system are the wound itself is completely covered with a dressing, which keeps it clean. It helps keep the wound's edges approximated and helps reduce the risk of wound dehiscence. If there is any drainage, it goes into the collection container, and that can be changed when it gets full. And of course, it reduces the swelling at the surgical site itself. It is a convenient setup because the unit we used to see, the Prevena 125, is a little bit smaller than the one we're seeing now, the Prevena Plus. The Prevena 125 wasn't much larger than a cell phone. The Prevena Plus is a little bit larger, but it does come with a carrying case and a strap, and the strap is pretty large, so you can kind of wear it wherever it's comfortable. That allows the patient the freedom to perform their ADLs, do their physical therapy, and not have to worry about what do I do with this box that I have to carry with me. Can hang it wherever it's convenient and comfortable for them. Some people have trouble with things around their neck, but this way you can put it, across your body, around your waist, or what have you. Basic operation of the unit is pretty simple and self-explanatory. Obviously, there's a power button to turn it on and off. There is a button to mute it if there is an alarm, and all the instructions are included. There's a battery indicator that shows you when it's charged or needs to be charged for the rechargeable unit. And we recommend to all the patients that when they're not up ambulating out in public or otherwise, that they keep the unit plugged in so that it stays charged when they are on the go. There is an indicator light on there that shows that it's plugged in or fully charged. And then, of course, when the dressing is on, like any other negative pressure dressing, it starts out as a piece of foam, and then when it's on correctly and the unit is working properly, it sucks down almost completely flat and has a wrinkled appearance. There are also indicators for trouble times. If there's a blockage in the tubing where it can't get a good suction, or if the tubing's kinked, it's twisted, some other something that blocks it up, the alarm will sound and the indicator will light up by that little X. And then of course if there's a leak, it will also alert them. And like I said, they're sent home with a kit, and the kit usually includes extra pieces of Tegaderm just to help reinforce. If they have any trouble at all, they can also call the 800 number or the representative for the Prevena, and the gentleman will talk them through it. Of course, the low battery alert is pretty self-explanatory. When the life of the therapy has completed, there will be a series of beeps, and then the unit will turn itself off. If for some reason the patient hasn't gotten to the physician for their follow-up appointment before this happens, then they can just call the doctor and find out what to do. I have actually had a patient call me at one point because she had a leak in her system, and she was concerned that it was actually dangerous and life-threatening, that it was leaking in the middle of the night and not providing the proper suction at the time. If you have any questions, you can always ask me. You can always call the Prevena. KCI is the company that created the Prevena. And I've also included a YouTube link here for a quick video on the Prevena 125 system. Thanks for watching.